A hearty welcome to everyone tuning into Dr. Nguyen's YouTube channel, your trusted source of health information. Today, we're peeling back the layers on a topic of paramount importance: diseases often contracted during war. As we journey into this topic, we'll not only identify these dangerous diseases, but also learn about their prevention and treatment. Knowledge is power, so let's empower ourselves. Join us as we delve into the top 10 dangerous diseases that can easily be contracted during war and how to prevent and treat them. Starting our list at number 10, we have malaria, a deadly disease transmitted through the bite of an infected mosquito. This relentless parasite triggers a spectrum of symptoms, from high fever and chills to severe sweating and body aches. In more severe cases, it can lead to complications like anemia, hypoglycemia, and even cerebral malaria. Now let's talk prevention. The key lies in avoiding mosquito bites in the first place. Use insect repellents, wear long sleeves and trousers, and sleep under a mosquito net, especially in malaria-prone areas. As for treatment, it's all about swift diagnosis and prompt medication. Anti-malarial drugs, prescribed by a healthcare professional, are the first line of defense. But here's the thing: malaria is preventable and treatable. Yet, it continues to claim hundreds of thousands of lives every year. We can change this. Remember, prevention is better than cure, so ensure to use mosquito nets and repellents in malaria-prone areas. Next on our list, at number 9, is cholera, a bacterial disease causing severe diarrhea and dehydration. Cholera is primarily caused by the bacterium Vibrio cholera, which thrives in areas with poor sanitation, often escalating during times of war due to the disruption of clean water and sanitation services. Symptoms typically include sudden onset of watery diarrhea, leading to severe dehydration. In severe cases, if left untreated, cholera can be fatal within hours. Prevention is primarily through maintaining good hygiene, especially proper sanitation and safe water. Vaccination is also available, although it's not as effective as proper sanitary practices. Treatment involves prompt replacement of the fluids and salts lost through diarrhea. Oral rehydration solution, a pre-packaged mixture of sugar and salts to be mixed with water, is used worldwide to treat dehydration. In more severe cases, intravenous fluid replacement may be necessary. Maintaining good hygiene and sanitation practices can significantly reduce the risk of cholera. At number 8, we have tuberculosis, a bacterial infection that primarily affects the lungs. Tuberculosis, or TB, is a silent hunter, often lurking without symptoms until it's well established. It's caused by a tenacious bacterium called Mycobacterium tuberculosis, which can dwell in your body without making you sick, a state known as latent TB. Symptoms of active TB disease may include a persistent cough, chest pain, and coughing up blood. Weight loss, fatigue, and night sweats are also common. Preventing TB in conflict zones can be challenging, but basic measures like good ventilation in living quarters and wearing a mask can help. Vaccination with the BCG vaccine is also a preventive measure, especially for children. When it comes to treatment, TB is a marathon, not a sprint. A combination of antibiotics over a period of 6 to 9 months is the standard treatment. Early detection and proper medication are crucial in treating tuberculosis. So, it's essential to be aware, be vigilant, and seek medical help early. Coming in at number 7 is hepatitis, an inflammation of the liver. This disease is a silent invader, often showing no signs until the liver is seriously damaged. Symptoms, when they do appear, can include fatigue, yellowing of the skin and eyes, and abdominal pain. There are 5 main types of hepatitis viruses, labeled A through E. Hepatitis A and E are typically caused by consuming contaminated food or water. Hepatitis B, C, and D usually occur as a result of contact with infected body fluids. Prevention is key in the fight against hepatitis. Safe practices such as using clean needles, avoiding unprotected sex, and not sharing personal items like razors or toothbrushes can significantly reduce the risk of contracting the disease. In addition, vaccines are available for hepatitis A and B. There's no specific treatment for hepatitis. It's more about managing symptoms and giving your body the best chance to fight off the virus. Safe practices, regular checkups, and vaccinations can help prevent hepatitis. Next up, at number 6, we have HIV/AIDS, a chronic, potentially life-threatening condition. This virus attacks the immune system, hindering our body's ability to fight off infections and diseases. Symptoms can vary greatly, from flu-like symptoms in the early stages to more severe complications like weight loss and fatigue as the disease progresses. Preventing HIV/AIDS is key, and this can be achieved through safe practices. Always use protection during sexual encounters and never share needles or syringes. Regular testing is also essential, especially for those in high-risk groups. When it comes to treatment, antiretroviral therapy, or ART, can help manage the disease and prolong life. ART is not a cure, but it allows individuals living with HIV/AIDS to lead a healthy and productive life. In a war scenario, ensuring safe practices can be challenging, but it's crucial to take every possible precaution to prevent this disease. Remember, prevention is the best defense against HIV/AIDS. At number 6, we have typhoid, a bacterial infection that can spread throughout the body. Typhoid fever is caused by the bacterium Salmonella typhi, and it's transmitted through contaminated food or water. The symptoms usually develop 1 to 2 weeks after exposure and may include high fever, headache, abdominal pain, and rose-colored spots on the skin. Preventing typhoid is all about hygiene and sanitation. Careful food preparation and hand washing with soap can significantly reduce the risk. When in areas where typhoid is common, it's also advised to only consume food that's hot and drinks that are bottled or boiled. Treatment for typhoid typically involves antibiotics to kill the bacteria. In some cases, resistance to antibiotics may occur, making treatment more challenging. Vaccination is also available and can be a crucial preventive measure for those in high-risk areas or traveling to such places. Vaccination and good hygiene practices are key to preventing typhoid. And remember, early detection and treatment can significantly improve recovery outcomes. Coming in at number 4 is dysentery, an inflammatory disease of the intestine. This unwelcome guest tends to make its appearance in conditions of poor sanitation, often during times of war. Dysentery is characterized by severe diarrhea with blood or mucus in the stool, accompanied by fever, abdominal pain, and a feeling of wanting to pass stools, even when the bowels are empty. Now let's talk prevention. The key to avoiding dysentery lies in maintaining good personal hygiene and food safety. Wash your hands thoroughly, especially before handling food and after using the bathroom. Ensure you consume safe drinking water and avoid raw or undercooked food. If you happen to catch dysentery, don't fret. Treatment typically involves fluid replacement to prevent dehydration, and in severe cases, antibiotics may be required. Remember, the best way to fight dysentery is to prevent it in the first place. Maintaining good personal and food hygiene can help prevent dysentery. At number 3, we have yellow fever, a viral disease spread by a particular species of mosquitoes. Yellow fever is a severe, potentially fatal, systemic infection that predominantly occurs in tropical areas of Africa and Latin America. The symptoms often include high fever, chills, headache, muscle aches, loss of appetite, nausea, and vomiting. In severe cases, it can cause jaundice, kidney failure, and hemorrhagic symptoms, which gives the disease its name. The best way to prevent yellow fever is to avoid mosquito bites in the first place. This can be achieved by using insect repellent, wearing long sleeves and pants, and staying in accommodations with screened windows and doors. But the most effective prevention measure is vaccination. The yellow fever vaccine is safe and affordable, providing effective immunity within 1 week for 99% of those vaccinated. It's a single-dose vaccine, providing lifetime protection without the need for a booster. Vaccination is the most important measure to prevent yellow fever. Coming in at number 2 is plague, a serious bacterial infection that's transmitted by fleas. This menacing disease, known throughout history for causing widespread pandemics, presents with high fever, chills, weakness, and swollen lymph nodes. The disease is particularly threatening as it can progress rapidly, potentially leading to severe complications and even death if not treated promptly. Prevention of plague primarily involves reducing exposure to fleas and potentially infected animals. This includes wearing insect repellent, avoiding contact with wild rodents, and maintaining good hygiene practices. In war-torn areas, these preventative measures can be challenging, but they are vital for survival. Treatment involves the use of strong antibiotics, which can effectively combat the bacteria if administered early. In severe cases, supportive care in a hospital environment may also be necessary. Remember, plague is not a disease to be taken lightly. Early detection and treatment can help prevent complications and death. And finally, at number 1, we have Spanish flu, an H1N1 influenza A virus. This deadly strain of flu was responsible for one of the most devastating pandemics in human history, claiming millions of lives back in the early 20th century. The Spanish flu is characterized by symptoms that initially resemble a common cold. However, they quickly escalate to high fever, severe body aches, and extreme fatigue. Prevention of the Spanish flu, like many other viral diseases, is best achieved through vaccination. Regular hand washing, avoiding close contact with those who are sick, and maintaining a strong immune system through a balanced diet and regular exercise can also help in warding off the virus. If contracted, the Spanish flu is typically treated with antiviral medications, rest, and fluids. Early detection and treatment can significantly improve the prognosis. Remember, the Spanish flu, while rare today, remains a potent reminder of the need for vigilance in disease prevention. Vaccination, good hygiene, and a healthy lifestyle are critical in preventing the Spanish flu. So there you have it. The top 10 dangerous diseases that can easily be contracted during war, and how to prevent and treat them. It's a sobering list, but it's crucial to be aware of these threats. Remember, prevention and early treatment are your best weapons against these diseases. Arm yourself with knowledge and take necessary precautions. Stay safe, stay healthy, and remember, knowledge is the first step to prevention. Thank you for watching Dr. Nguyen's YouTube channel.